Meanwhile, in South Africa, health officials there say that men are more reluctant to get the COVID-19 vaccine. Reports indicate that almost 60% of those who have received COVID vaccines so far are women. As of August the 17th, over 9 million vaccines had been administered in South Africa. Reporting from Johannesburg, here's CGTN's Yulisa Njamela.
According to the National Health Department, the discrepancy is a significant one. Of the 7.2 million people in South Africa who have so far received at least one dose of the vaccine, only 40% are men. That means 2.8 million men compared to 4.3 million women in the country have presented themselves for a vaccine. Misinformation, myths, and fear are just some of the issues that health experts are saying are the reasons for vaccine hesitancy.
It seems the myths that are circulating around the vaccine are actually overpowering what is factually out there. So it seems there's a need. In fact, we propose that we go aggressive in terms of vaccine education. And as we do that, we need to take into cognizance the various population groupings and differentiated mechanisms of reaching them.
We went out to ask a few men why they are reluctant to be vaccinated.
I feel like we weren't educated enough. I'm afraid that if I do take it, it's going to kind of like mess with my genetic formation. Is the vaccine part of a population control strategy?
We need to see the long-term effects of this. Before I put it into my body, I need to understand exactly what's going to happen.
I don't think I'll go for vaccine. Something that just came up now, and it's not been like tested. Something we don't know it's going to work.
Vaccine, for me, it seems as if I can, at least if it's tested for a while, maybe for 1 to 2 years from now, I will get vaccinated.
Some health experts, such as Professor Paswana Mafuya, are of the view that to alleviate this situation, perhaps it's time that government implements a more focused way of encouraging vaccination.
We have seen similar type behaviors where people would generally respond more effectively if mechanisms that are appropriate to them are used, their language, their cultural context is taken into consideration. For example, traditionally, women play a more caring role for their families than males, and they tend to be the ones that utilize healthcare services in terms of child care health and sexual reproductive health than their male counterparts. And therefore, they tend to be exposed more to information in various ways, sometimes as they utilize the health facilities, than their male counterparts.
Earlier this week, the government announced that there are plans to reach more men. Those plans are due to be unveiled by the end of August. Yulisa Njamela for CGTN in Johannesburg, South Africa.
We're staying with that story, and we're now joined by Dr. Angelique Coetzee, the chairperson of the South African Medical Association. Thank you so much for joining us on the program, Dr. Coetzee. We've just heard that report about men appearing to be more reluctant than women in South Africa to be vaccinated. We heard some of the reasons from some of the people that were interviewed in that report, but why do you think that is?
Good evening, and good evening to all your listeners out and viewers out there. I'm coming from a bit of a different perspective. So, and I'm saying if you look at traditionally, women are the nurturers. So who goes to the doctor? The females. Who takes the children to the doctor? Females. Who take the men when they are sick? Who make their appointments? Females. So that's the one thing. Males are they are the providers. They're not the nurturers. So for men just to make an appointment out of their own to go to to get the vaccine is not really part of how they have been brought up. So you need a female to make the appointment and get them there. That's the one thing. The second thing is, if we look, we have started with the 60s pluses with our vaccines. If one guy, and I don't think the stats shows this clearly to us, but again, in South Africa, most of the times it's the females that outlive the men. And therefore, you will see much more females above the age of 60 getting their jab, simply because there are more females than males. And again, if the male are living on his own and his children are not there, there's no one to nurture and make an appointment, he will not do that easily out of its own. It's not that he doesn't want to get the vaccine, it's just not part of his makeup. And I think one needs to look at these type of stats. So again, when you look at the economic age group, that's the age group between 30 up till, again, 55, 60, again, mostly men. And if the vaccines are not coming to their workplace, you are going to find it difficult for men to make, again, out of their own an appointment if they don't have a secretary to do that. So I think it's part of who we are, where we are coming from. It's not because they don't want to take the vaccine. It's just they are the providers and we are the nurturers as female.
Another thing that we had heard of in that report was that term vaccine hesitancy, and I think it has been not just for South Africa, but a global phenomenon. What we have heard is the South African government saying that it will not mandate vaccinations in that country. Can you speak to us about what just some of what the authorities are doing in terms of vaccination campaigns there?
There's a lot of vaccination campaigns going out. There's policies around this, where companies need to bring a policy to the table. They had a deadline in July, tell how they are going to make sure that their employees are safe, and what are you going to do as an employer to make sure that your employees gets themselves vaccinated. We also know that some of the big medical schemes or insurance companies like the likes of Discovery are going to give discount or a lower rate for those members who has been vaccinated, as that will bring down their costs regarding hospitalization. And then there's, we have a lot of people like SAMA, the media in South Africa. All of us are trying to get as much information out there to the public regarding vaccines. But it's also important to understand that if you want to convey the message, you need to speak the language of the patients. And with that, I mean, you need to understand what is important to them. What are their fears around hesitancy? Why don't they want to take the vaccines? And this is communication. And although we are doing a lot of work around that, I don't think there's enough communication. And I think, with all the past few months that we have seen regarding corruption and all of that in South Africa, I think the trust of the average person out there are not where it's supposed to be. And remember, South Africa struggled. We first had the AstraZeneca, and we were telling people we're going to get AstraZeneca. Then consequently, we found out that we cannot give that against our Beta variant. Then we started with the Sesonke, and then it becomes trials to be able to vaccinate those healthcare workers. Then we said we're going to bring in Pfizer. We brought in Pfizer, and we said 21 days, and then we realized we don't have enough vaccines, and we went to 42 days. And then we had the problem with Johnson & Johnson, with what happened in America, and unfortunately two of those batches were received in South Africa. And we started late with the program, and then we had this system where people need to register on the system. Now, let me tell you, South Africans traditionally are not people that go on appointment systems. The average person out there are what we call walk-ins. and that's how they have been brought up, and this is how they do it. So, and again, not everyone had access to electronic devices to get themselves registered on the EVDS system. And again, difficult.
Doctor, so many of the challenges that you've mentioned there that South Africa went through, and have answered that question quite brilliantly. But some countries, like Kenya, for instance, have reportedly gone to the extent of threatening disciplinary action against unvaccinated civil servants. What do you make of such approaches?
Well, still, I think everyone's got a choice, but the choice must be based on good evidence, factual evidence. We should not get anti-vacciners into the equation here, as that confuses everyone. And at the end of the day, it's your right. You have got a right to decide not to get vaccinated, but I also have a right to say, you're a medical doctor and you have not been vaccinated. Do I want you to examine me because you've got a higher incidence then of maybe spreading the virus to me as a person or to my family? So yes, you've got a right, but other people also have got a right.
Thank you so much for all that, Dr. Angelique Coetzee, chairperson of the South African Medical Association.